Now, what are the long-term effects of celiac, and how is it treated and managed?
Sure. So this is a great question, Lisa, because sometimes people just think with us with celiac disease, we just have a bellyache, but some of the long-term health consequences are serious because it leads to nutritional deficiencies, but it also can lead to intestinal cancers, thyroid cancer, osteoporosis, short stature in children, so some stunted growth, and then in women, it can lead to miscarriages and something called intrauterine growth retardation, which is stillbirth. So it is a very, very serious, disease, and it's important that anyone is totally with celiac disease is totally vigilant with their gluten-free diet.
So if you have a child with celiac, for example, how would a parent help a child manage it on an everyday basis?
So it's real. What we find is that it's really good, and we have a whole resource on our website. It's celiaccentral/kids. That the kids not only do the parents keep a gluten-free household, but that they teach their kids to advocate for themselves. So they have to let kids learn on their own, because when they go out into the world, just think when you go into a school and you look around that cafeteria, there's so many foods that contain gluten from, whether it's pasta or bread. They have to teach the kids that not only can they not have food that contains gluten, but they can't even have any kind of cross contact. So that means if you have croutons and you put it on a salad and then pull the croutons off the salad, any of those particles that are left on the salad set off that autoimmune reaction. And it's really important that the kids can be empowered and advocate for themselves. So they have to teach their kids to really be able to speak up. And these kids, even in the cafeteria setting, they're not going to be able to share food with their friends. And, let's say they're involved in after-school sports. They really need to make sure that they are packing them, gluten-free food. And there's lots of varieties of gluten-free food, and naturally gluten-free food, like fruits and vegetables and things. But the kids, they really always have to be prepared. You really have to prepare in advance of, socializing with other children, and even when they're eating outside the home.
I know